Okay, so good morning. My name is Celine Natalie, your doctor. What is your name? Okay, Dylan, today we will be doing the circumcision using the dorsal slit method, and I'll be giving you local anesthesia, and I'll be doing the dorsal slit method. Are you okay with that? Okay, can you please fill in the informed consent form? Okay, thank you. Could you please now lay down on your back? Okay, next I will be doing hand washing, and after that, I will prepare the PPE. Okay, since I've already done the hand washing, I've worn my surgical gloves, I will wear the surgical cap and surgical mask. And I have prepared the tools over here. I have the needle holder, anatomical and the surgery pincet, the clamps, which is the straight and the curve, and also the scissors. Okay, next I'll be disinfecting the penis and the surrounding area with the disinfectant fluid. So I'll be disinfecting from the penis inside in a circular motion from the inside out to the area of the umbilicus over to the proximal femur. Okay, since I've already disinfected that, I will narrow the field of action with a sterile surgical cover. So I will drape this. Okay, so next I'll apply local anesthesia using the ring block method. So here is the syringe and the lidocaine of 1%, and I will inject the suitable dosage, and I'll be using the ring block method. Okay. I will aspirate first to see if there's no any blood, so I don't see any blood. Therefore, I will slowly inject as I pull out, and then I will change direction without pulling the needle out, and I will aspirate and slowly inject because I see no blood as I pull out. Okay, and then I will create like a triangle, so I will inject it over here. Okay, next I will aspirate. I don't see any blood, so I will inject as I slowly pull it. Okay, so we're done with the local anesthesia. So I injected the needle subcutaneously before into the proximal dorsum of the penis. I've aspirated it to ensure that it doesn't hit a blood vessel. Okay, next I will wait for around 3 to 5 minutes. Okay, 3 and 5 minutes already passed. I will confirm whether the local anesthesia is working. Okay, so Dylan, can you feel any sensation? No? Okay. Therefore, the anesthesia has taken place. Next, I'll be cleaning adhesions if found with a clamp. So I'll pull the prepuce proximally. Okay, so I don't feel and I don't see any adhesions. However, I will repeat the pulling of the prepuce until the corona gland sulcus and the base of the prepuce mucosa are visible. And here I don't see any smegma. However, if I find any smegma, it will be cleaned by a gauze soaked in povidone iodine until it's totally clean before we can begin with the dorsal slit procedure. And during the pulling the prepuce proximally, I will check if there is any absolute contraindications to the circumcision. Okay, next we will begin with the dorsal slit procedure. So here I'll be taking the straight clamps, and I'll be clamping it in the 3 and 9 o'clock direction, which is here. Okay, so it's been locked. Next, I'll be taking the curved scissors, and I'll be clamping it in the 11 and 1 o'clock position. Okay, so I have clamped it in the 11 and 1 direction. Okay. So next I will be marking where the prepuce will be incised at the 12 o'clock. But before that, I will be marking the coronal gland. Okay, so the coronal gland is right over here, therefore I will mark it. So after marking it with a surgical marker, I'll mark the dorsal slit. So here is the middle, which is at 12 o'clock. And I will crush it a little. And I will mark it with a surgical marker. Which has been sterilized. Okay, so we'll now begin the dorsal slit procedure. So I'll be using a tissue scissors with the blunt point facing the skin, and I will incise it. Okay. So I will incise the slit, and I will continue to the circular. So I have cut the cut skin and the mucosa with the forceps and continued with the circular resection of the prepuce, and the frenulum has not suffered any resection. Next, I will check if there's any bleeding. I'll locate the source of bleeding if there's any, which I don't see, by wiping the wound area with a gauze. Okay. And if there is any source of bleeding found, I will immediately stop it with pressure, dressing, or clamp it with a curved artery clamp, and do a ligation if it's necessary. So I don't see any source of active bleeding that needs to be attended. Next, I will do a frenulum suture with a mattress suture. So I'll be inserting the needle of the skin beside the raphe of the penis, continue in and out parallel to the remaining mucosa. So in the 6 o'clock direction. Next, I will reinsert the needle into the mucosa opposite the frenulum until the skin comes out again on the side parallel to the second puncture. And I will tightly knot the suture ends at least 3 times. So that is in the 6 o'clock direction, which is over here. And that will be using the horizontal mattress. Next, I'll be suturing the mucosa and the skin. So before that, I will reconfirm if there is any active bleeding. And then I will do the suture of the mucosa and the skin between the edges of the remaining mucosa and the skin. And I will knot the suture at the 12 o'clock position first, and then moving on to the 3 and the 9 o'clock with a horizontal mattress suture. And then I'll be performing the simple interrupted stitches at the 2, 4, 6, 8, and 10 o'clock position. Usually I will stand right at the patient, but for video purposes, I will turn the patient around. Okay, so I'll be stitching with a using a sword and scissors as part of the tissue handling. Okay, next I will tie the suture for at least 3 times. Okay, so that is for the horizontal mattress. And I will be doing the following horizontal mattress on the 12 o'clock direction, which is over here, followed by the 3 and the 9 o'clock. For the 2, 4, 6, 8, I'll be doing a simple suture. Okay, so next I'll be doing the simple interrupted suture. Okay, that's it. Yeah. Okay, that is it for the horizontal mattress, and I'll be doing it in the 12 o'clock position next, which is over here, followed by the 3 and the 9 o'clock position. And after that, moving on, I'll be doing the simple interrupted suture in the 2, 4, 6, 8 direction. So I'll be doing in this direction first. Okay, and I will cut the extra suture using a different scissor. Okay, so next we will be moving on to the dressing of the wound. After suturing, I will be applying betadine, which is the povidone iodine here, to the edges of the wound. Okay, and then next I will cover it with the paraffin gauze and the plaster to ensure that the urethral opening is free and, as much as possible, never exposed to the urine. So next I will be disposing the PPE in a medical waste bin, so the surgical gloves, the mask and the cap, and then I will do 6 steps hand washing. Okay, and I will record all the procedures that happened today in the medical record of Dylan, including like the number of sutures, the type of sutures, and the type method of the circumcision procedure used. And I'll be prescribing analgesic and antibiotics medication. For the analgesic, I'll be using mefenamic acid 500 milligrams 3 times 1 orally, and antibiotics amoxicillin 500 milligrams 3 times 1 orally. And after the patient is calm and composed, I will be educating him. Okay, so the wound should not be exposed to water for at least 3 days, and if you find any bleeding, please immediately see a doctor. And after urinating, please wipe off any remaining urine with a gauze to ensure that it is sterile. And please consume nutritious food and drinks, specifically those that has a lot of protein in it, like meat. And after 3 to 5 days of post-circumcision, please see a doctor for wound care or to remove the dressing. So we're done for today, Dylan. Please, if you have any questions, feel free to contact me. Thank you.